and I will be presenting my current issue in nursing. The community is at the University of Kansas Health System electrophysiology lab. They do procedures on patients with heart arrhythmias and also provide pacemakers and devices for severe heart failure patients. The program offers the full spectrum of therapies within the realm of clinical EP, including AFib ablations, VTAC ablations, as well as the newest technologies as left atrial appendage closures and other device-based therapies. They approximately provide procedures for over 2,500 patients per year. The facility opened in 2001. There are 4 EP labs, and they share an operating room with the cardiothoracic surgery team for extractions of devices. The University of Kansas Health System is a magnet designated facility and is also the first hospital in the nation to receive the comprehensive cardiac certification, and I'll go over that here in just a little bit. The EP lab is dedicated to providing the highest level of care for their patients. The health system was the first hospital in the nation to achieve the comprehensive cardiac certification. It is an honor awarded by the Joint Commission, stating that they meet specific needs of quality for heart failure patients and cardiac patients. The issue I am outlining is clarification of specimens and refining the process and ordering requisitions for those specimens. There are basically 2 reasons why a patient pacemaker system gets extracted. It's either because the leads aren't working properly or the device is infected. If the patient has an infected device, the physician will send parts of the pacemaker and tissue samples to the lab in order to determine a proper antibiotic regimen. During this process, there has been confusion between the EP lab and the lab as to which order is paired with which specimen. There's also been wrong orders placed for the wrong specimen. There are many consequences when there is confusion with specimens, and the patient is the one who is affected by this process. I and the team intend to refine this process so that there is no confusion between the lab and the specimens that are needing to be analyzed. Analyzing the tissue's strengths, proper labeling and ordering will provide less confusion. It will also reduce confusion between the labs, giving both labs more time to providing quality care to patients, and it will obviously reduce errors in improving patient outcomes. Weaknesses: the current process is confusing to both EP lab and medical laboratory. Wrong orders are being charged to patients, increasing the healthcare cost and stay for the patient, and the current process is detrimental to patient safety. First thing we should do is have a meeting with the lab director and the EP lab director to clarify and create new order sets for the EP lab. By doing so, we will open a dialogue between EP lab and the testing lab to eliminate confusion. Second, after the order set is created, we teach the staff how to use it. We also reinforce the importance of date, time, and initialing the specimen. We also have a 2-nurse checkoff system in place to check every specimen and order. Third, reassess and gather input from staff and whether the new order set has eliminated the confusion between the labs. Recommendations. Research has shown that effective communication and technology can reduce confusion and reduce labeling errors. Here's 3 studies that I found online, basically stating that proper labeling and identification of lab specimens has reduced complications and has also improved outcomes for the patient. Here's the references, and thank you.